Stockbridge on securing the debate. Many of us, when we come to put a speech together, think of different ways and processes. Some use the rule of three when they put a speech together, and I want to refer to three words today that I hope the Minister and her colleagues in government take notice of. Do no harm. Regardless of the Chief Medical Officer's overruling of the JCVI, I would say when it comes to our nation's children and our young people, those in those roles should remember that their actions should do no harm. Our colleagues in government, whether newly appointed or not, should also be mindful in respect to the electorate's children that they should do no harm. The new Minister will be aware of the strength of feeling displayed to her predecessor, the Right Honourable Member for Stratford-upon-Avon, and the government in the COVID passport urgent question recently. It is again a fallacy that such direction that this government wishes to take will protect our children, especially as 50 to 70% of those are already likely to have had contracted and survived COVID-19, according to the ONS. And so, are we really showing that we are doing no harm? And any vaccination programme, we are told, would not negate potential future school closures. So what is the point? Where is the political backbone? Is the government plan that any future upsurge in 12 to 15 cases could be perhaps ascribed to an epsilon, a zeta, perhaps an eta or a theta variant? Will anyone give an iota of credence to such an occurrence after what we have seen with hospital transference to care homes and our older generation, the subsequent surge in cases and the recent vaccination and Delta variant that has emerged? We should be mindful as politicians on all sides of this House, and I do note at this point that there are not even three opposition spokes or representative spokesmen on the other side, but I do see that the opposition spokesman is in her place. We need to do no harm for a myriad, if not a veritable plethora of reasons. I now turn my attention to the so-called Gillick principle. As no trials have been made public that are definitive, I fail to see how any child below 16 can be fully informed. And to be fully informed, one would say that their teachers and head teachers cannot be either about the safety or otherwise of these vaccines, particularly in light of the heart impacts on young males and the reported effects in over 35,000 females of reproductive age reported in the UK national media this very last weekend. Can the CMOs and the JCVI really hold themselves, after their recent decision-making process, to the maxim that they will do no harm? Also, vaccine passports are not a first line of defence against a potential so-called winter wave of coronavirus, as Downing Street spokesmen are reported to have said. And our children of 12 to 15 years are not, like their older siblings and other under 25s who frequent nightclubs, bars and restaurants, to be used perhaps as a second line of defence either. Yeah. I urge the Minister to remember, and her colleagues in government to remember, to do no harm. There is no medium or long-term study data. I admire Chris Whitty and his colleagues for many things that they've done in the last 18 months. However, attempting to cite educational disruption or the fear of more of it for justification for the child vaccination against the JCVI advice seems a little bit desperate as far as I'm concerned. We were told that that all those at risk needed to be vaccinated. They have been. Many others have caught and survived COVID-19. So what real justification is, or is there now to vaccinate those under 40 at all, perhaps some would say? Because we've had various millions of vaccinations. How many of those under 40 with underlying health, without any underlying health issues, have died or have been hospitalised purely because of COVID-19? So why are our children still taking tests, as we've heard being referred to already, after a whole summer of not doing so? Is it because perhaps that there are thousands, if perhaps not millions, of these tests sitting in warehouses? What sort of reason is that to impose this regime on them? Are we really ensuring that we are doing no harm? Are the zealots in the civil service, the NHS and government going to stigmatise and demonise any parent who expresses concern about ensuring vaccination of our young children through fear and perhaps lies again? To take a vaccine that has had no long-term testing does not stop you getting the virus and does not stop you passing on the virus. Do no harm starts to have a very hollow ring to it. If COVID risk for young people is much, much lower, perhaps there are heart risks for males as a real concern, and reproductive females are suffering side effects, how does the Minister square that circle that we should do no harm to our young of the UK, the next generation, who will be paying for this government's and Minister's decisions for many, many years, and I fear perhaps in more ways than one? Thank you.